Welcome back. Pradeep Yadav, an interventional cardiologist at Penn State Heart and Vascular Institute, joins me now. Now, earlier we mentioned that about 6 million Americans have atrial fibrillation, that it's a common cause of stroke. So what is it? Why does it cause strokes?
Right, so atrial fibrillation, like you said, is very, very common. It's the commonest type of heart arrhythmia in which the top chambers of the heart don't squeeze very well, and the blood kind of stagnates and pools around the walls of the heart, and then the blood clot can then dislodge, go up the brain, and cause a massive stroke. It's very common. Almost 75,000 strokes a year are caused by atrial fibrillation in the United States. And if you look at the elderly population above the age of 80, almost a quarter of these strokes in them are attributed to AFib.
Those are really scary numbers, but can it be prevented? Can these strokes be prevented?
Correct. Traditionally, we've used blood thinners to prevent these strokes, and blood thinners reduce the chances of clot formation inside the heart. And we've used them for decades, and they're very effective. However, a third of the patients don't tolerate these blood thinners for a variety of reasons, for example, internal bleeding.
So one of the procedures that we had talked about was the Watchman procedure. Correct. So how does that work?
Right. So it turns out that 90% of these clots are formed at one spot within the heart. And I have a 3D print from a patient's CAT scan. And this little outpouching from the left upper chamber of the heart is called the left atrial appendage. And that's where 90% of these blood clots are formed. Now, if we can find a way to close the opening of this appendage, we could prevent strokes.
Okay.
And Watchman is one such plug. And in fact, Watchman is the only FDA-approved device for stroke prevention in this.
And this is also with a catheter. You do this.
Correct. It's a catheter-based technique where we bring the patient into the cath lab. This is typically done while the patient is on a breathing tube on a ventilator. Then we make a little incision in the vein in the leg and advance this catheter all the way up to their heart. We are on the right side of the heart, then we make a tiny hole in the heart to cross over to the left side. And once we reach this appendage, we advance this device and open this device right in the appendage like this.
Very good.
And if we are satisfied with the positioning, we can take this delivery system out, and this little plug at the end, which is the Watchman, it stays in.
Gosh, it's so little and makes such a difference. It's so interesting. Thank you so much, Doctor. Well, just ahead, we're going to take things into the kitchen with Carrie. What do you got going on, Carrie?
That's right. I have a dietitian, Courtney Hager. She's going to be here with some very heart-healthy food tips. But now, right to Deborah.
Do you have a question about heart disease? Join us for our live web chat at abc27.com/heartchat. Dr. Farbaniak is busy answering your questions. He will be here until 1:30 this afternoon. Stay with us for this special edition of Good Day PA.